Welcome everybody to the Knuckle Dragon Billy Goat review with Mike and Josh. I'm Mike,
And I'm Josh.
and what we're trying to do tonight is we're gonna have a little impromptu discussion on the human euthanism. So Josh had posted an article on Facebook which caught my attention, and I just had to get him on the line here and see what we can figure out because I'm kind of on the fence with if this is ethical or not, and Josh has actually written some papers on it. So I want to get his point of
Yeah.
view. Yeah, I want to get your point of view, and then I have some personal thoughts on it that we can talk about later. But why don't you kick us off and kind of give us some history and background and your opinion?
The euthanasia, there are approximately 2 billion youth in Asia. Oh no. You want to talk about youth in Asia. Euthanasia, as you talked about, is basically it's a controversial topic, right? But it really factors into a person's willingness to live. And more so, we're talking about people with chronic or terminal illnesses or people late in adulthood with failing health, which is kind of funny to think about. The life expectancy in the United States in 2010 was almost 78 years old. And we think living longer would make people happier. That's not necessarily the truth, right? People have a certain quality of life they want to maintain, okay? So there's other deciding factors with this willingness to live from a purely psychosocial perspective. Woo-hoo! But but the health market here, it does provide a pretty physical indication to the quest. They say here for the quality of life, it's directly proportionate to your physical health, which that kind of makes sense. You know, if you're in shape and feel great and all that, you know, your mind, body, spirit, whatever you believe in type deal, it's going to work well. But, you know, as we do get older, our cells degrade. Um, Especially with the elderly are really prone to Alzheimer's and Parkinson's disease, and that's shitty. But Michael, pop quiz. Do you know what the number one killer of the elderly is?
I'm gonna guess malpractice.
Woo, that would probably be a good one. According to Santok here in his 2011 article that he wrote, he says that cancer is the number one killer of old folks. That's
Really?
crazy. Yeah, I
Is
would I would never thought that, but
is that including all the elderly that die in old people's homes?
yeah, I mean, I guess from the study he took, like I said, it's a statistical sample. Uh,
Dang.
as we've talked about before, statistics isn't necessarily indicative of everybody, but it is indicative of that certain subset, which is crazy. And I like how you started this off, Mike, about talking about the moral and ethical implications on
Right.
euthanasia. Uh, More so, the American view on death, it centers on denial and avoidance of death. You know, we don't like to talk about dying. We don't want to, you know, I don't like going to funerals. I don't like, you know, seeing people that are chronically ill. But a lot of this, you know, dealing with the terminal or chronic illness, there's a certain term called comorbidity, right? Let's say you do have cancer, you may also be
Okay.
depressed. You might also have anxiety. You might also have this or that or the other. It's basically a combination of things. Okay. And more so with this, let's say, you know, you do have cancer and you become depressed, right? Your
Right.
mood, it's been shown, affects your willingness to live. Who would have thought that? But I mean, it kind of thinks back to some of the discussions we've had about depression. You know, we know how we feel in that state, and it does affect, you know, your mood and going forward anyways. That's what I kind of find of interesting on that. More so the views on death. We talked about the American culture's view on death, but death in a lot of different places is seen as a different nature, really. You know, some see death as a retribution for sinful nature, you know, hellfire and brimstone. Some see death as a
Right.
redemption, you know, from this
Yeah.
life.
Yeah,
You
and then
know,
there's some that also think it's a spiritual release and you're becoming one again with the gods or your spiritual afterlife.
oh yeah, definitely, definitely. So I mean, there's a lot of different views on this, but I think it more so comes down to the physical. You know, are you in pain? And the pain gets too much to deal with conventional medicine or maybe conventional practices. You know, we've talked about pharmaceutical industry and how long it takes to get a medicine approved. You know, let's say they do find a cure for cancer, but it's 20 years down the road. Is that going to help you now that you have cancer? No, obviously not. You're going to die. If they don't
Right.
get it to go right, you are going to die. Uh, I wrote here, and this is kind of funny. We did talk about it. I said there are moral and medical debates that take numerous views into consideration on euthanasia. Pardon me. In the view of terminal illness in late adulthood, careful consideration should be made to ensure the integrity of this alternative method of healthcare. Dude, doesn't that sound? That sounds like some online paper writing to me, buddy. You know what I'm
Yeah.
saying? You know what I'm saying?
Yeah.
Mike, there's actually two different terms of euthanasia, right? There's a passive euthanasia and there's an active euthanasia. So passive, sorry, I can't talk, euthanasia. Let's just say that somebody pulls the plug on their life support, right? They're not
Right.
directly killing themselves. They are aiding it in a way, but not necessarily like with active euthanasia, right? We give somebody a cyanide pill, they take a cyanide pill and they die.
Right.
At the time I wrote this paper in 2014, so it's a little dated here, but the active euthanasia is illegal in the United States except for the states of Oregon and Washington. What I guess Hawaii is in here now, since the article that I shared from a friend's page is from the great state of Hawaii.
Well, there's actually more than that, Josh.
Go ahead. Yeah.
Yeah. So as of April 5th in 2018, California, Colorado, the District of Columbia, Oregon, Vermont, Washington, and Hawaii have all passed this law. It went into effect January 1st, 2019, that basically says if you have a terminal illness and it's been reviewed by multiple doctors, so I think the minimum is 2. You have to have 2 of the same diagnosis from 2 different physicians. Then you can then file to have assisted suicide. So there's actually quite a few states.
Yeah, that's like up to 7, I believe, if my count was right. I had to take off my socks to make sure my count was right on this one, Mike. But I think we're there. I think we're out of the woods there, and it's funny that it's growing. But I mean, just think about that. In the time that I got these stats from, 2014. That's only 4 years, and 3 other states have have gone to it. But my big concern with euthanasia goes almost against the Hippocratic Oath. Are you familiar with the Hippocratic Oath?
I think you're referencing the one that medical providers take.
Yes, that's the one that doctors take. That the Hippocratic Oath was made by Hippocrates, which almost sounds hypocritical, but it's not spelt the same, obviously. But one of the major clauses in it is to do no harm. So that gets me to think, if you're a doctor, what do you view? Are you doing more harm keeping somebody alive, or are you doing more harm to give somebody to have the means to take their own lives?
Right. And so I tried to apply the sense of like the prison system and using the death penalty. And my view on that has changed over the years. And currently it is, who are we to decide who lives and dies? So I'm trying to apply some similar logic to this assisted death, right? So should we be able to decide when we ourselves die? Like, should I be able to say, okay, I'm ready next week, Monday at 6 p.m. I'm going to go then. Is that ethical, or should I be allowed to do that? And then I'm also thinking about the abortion aspect. I think about abortion and the abortion argument, and I view it both ways. So in one aspect, I'm saying I think women should be able to do whatever they want, but I also don't think it should be forced onto a doctor or forced on anybody else to take part in it. So I'm just trying to find my line on where I think this is okay or not okay. And I'm still slightly on the fence with it. I don't know if it's entirely ethical. And I think there's a little bit of gray area here where people are going to start getting into trouble with, were they actually in a mental state where they could make that decision? Do families start fighting and arguing against this? And, I wanted to look up the definition of terminal because it does say you have to be terminal. Now, is there any leniency on terminal? Maybe somebody has a different idea or definition of what terminal means. And by somebody, I mean medical professionals. So I looked it up. So the Webster is of a disease predicted to lead to death, especially slowly, incurable. So if you're terminal, you have to have something that's leading to death. It has to be especially slow and incurable. So does that mean anything that's incurable? And is it only incurable today? Somebody could have assisted death today, but then 6 months, a year from now, it's no longer incurable. Maybe you could have had a successful life, but you didn't have that option because we helped you commit suicide. So I don't know where the line is here.
Yeah, you brought up really, really good points to it. And it really does open a Pandora's box, kind of going to your last point. Who knows if you have 6 months? If you're termed to be terminally ill, who knows if you have 6 months to live? And who should have a say if you live or die, if it's yourself making the decision? I mean, what harm are you explicitly making on society by dying? And I think it's the harm principle behind that. But I really like towards the beginning when you were talking about the mental health aspects of it. And one of the stats I have here in my paper, let me see here. It says in a recent study, this was recent as of 2000, what I have the quote of, is that 25% of these elderly patients that were terminally ill exhibited mental illness in the form of depression. Okay, so there's a quarter there. Now, is that a disqualifying condition saying, wow, you shouldn't die? Or you don't have the ability to say that you need to die? I mean, it's almost like an intelligence quotient. I mean, we've kind of talked about it before, where is the line to say that you're intelligent or not intelligent? Right. It gets into a large Pandora's box, I think, anyways. And here's my views on it, right? I go a lot of my life with the philosophy of the harm philosophy, right? The harm principle. If somebody's doing something that could potentially harm somebody in the immediate location, could potentially harm somebody like right now, or be potentially harmful down the road. Let's say, somebody smokes in their house. Let's just say it's somebody that smokes in their house, right?
Right.
Hey, it's their house. They can make the choice to smoke. But let's say they have kids and animals and other people in their house that don't smoke. You're harming those other people. I don't think you should be allowed to smoke in your own fucking house. Go outside. And this is coming from an ex-smoker. I've never smoked in my house, ever. When I smoked, never smoked in my house because it was my habit, and I knew it was a bad habit, but I was only going to affect myself in that particular situation. Now, with the euthanasia, I mean, who are you hurting? You might hurt your family members because you're gone, but you're not physically hurting them. So, I mean, it comes to a lot of the words that, the semantics behind it. But here we go. Just one more thing here. Oregon in 1994 had the Oregon Death with Dignity Act, or the ODAA, as I'll refer to it, going forward here. But it is basically what you said. It said it specifies that the act must not be used for suicide. We're talking about euthanasia here, mercy killing, or homicide within the law. I mean, what does it tell you? Okay, first of all, suicide. Yeah, you're killing yourself, so that's suicide. Mercy killing. Yes, I'm in pain. I want to die. I assume that's somebody killing you. Like, if I'm in stage 8, colorectal cancer or something, I'm like, Mike, put a bullet in my head in Paris, Illinois, and throw me in the field. I assume that'd be a mercy killing on the verge of homicide, almost in a way. So, there's a lot of factors on it that just. I'm in my political views, which I don't really touch on a whole lot of the times, I think people should have the choice to do what they want as long as it doesn't hurt others. Now, here's the thing, though. How do you know it's not going to hurt others if you take your own life?
Right, but I think you mean like a physical pain. Like I'm not actually cutting somebody else or killing anybody else.
Right. Definitely right.
So I want to touch on something you said. It kind of caught my eye, and I don't really agree with it. So
go for it.
Well, you said that somebody smoking in their house is okay or not okay, and then it would be different if there was like a child in the house. Well, I see a difference there because let's go with somebody smoking in their house, okay? And yes, we know cigarettes cause cancer and you can die from them. Everybody knows they're bad, right? So what's different about the two scenarios of smoking in your house by yourself and getting assisted death is that nobody is buying you those cigarettes and becoming a party to your death. Okay, so it would be very different if somebody was obligated by law to have to buy you cigarettes, which they are morally against, right? So say like someone like myself, I don't like smoking. I think it's bad. I think anybody who still smokes, knowing all the risks, is kind of silly. Like I don't know why people still smoke. Everybody knows it causes cancer. But let's say you had to go to the doctor to get your cigarettes, but the doctor is morally against these cigarettes because they know they cause cancer, but now it's in the law. So I think it's a different story when somebody's just smoking in their house by themselves and buying them by themselves. Now what people are doing with this terminal law where you can get assisted death is doctors in these states are now becoming, I guess, obligated to help kill people. So it's kind of, you're introducing other people. And I did some quick research prior to this, and it looks like pharmacies are kind of pushing back a little bit, not wanting to prescribe these medications.
Yeah. It said in the article too. I mean, there's certain medical practitioners, nurses, doctors, nurse practitioners, folks like that are, like you're talking about, morally and ethically against it. And I liken it to, you go to a regular doctor, you go to ear, nose, and throat doctor, right? And you're having a baby. Is the ear, nose, and throat doctor going to deliver that baby? Probably not, unless it's an emergency type situation. I don't see euthanasia being seen as an emergency type situation. And I almost see it being drafted into like this, right? So I'm terminally ill and I want to make a decision to end my life with euthanasia, right? So this is how I would structure it in Josh's morally awesome world. Okay. So I talk to my healthcare provider and I say, hey, I have stage 19 cancer. I'm not going to make it to Christmas. I want to die. And they're going to say, okay, well, let's refer you to this specialist. And I'm referred to a specialist and we talk about it. And then I talk to a psychiatrist and we talk about it. And then I write a contract or have a contract written up for me saying, blah, 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 blah. On this date, I want to do this. And I reserve the right to revoke that at any time during this process, knowing fully well what I'm about to get into. And then the day that I'm to perform my euthanasia, I talk to the psychiatrist again. I talk to the doctor again. I talk to whoever's going to administer this drug, if it's me or a nurse or somebody like that. And I'm checked off. I see it being really bureaucratic and it's really, really obtuse of a subject. That's kind of what I see anyways. But in my perfect world, that's how I would run my Euthanasia Express.
Let me ask you a question, okay? Because we spoke about pharmaceuticals in an earlier podcast. So let me ask you this. Do you think this would ever get to a point where money could get involved and you could pay a certain amount of money to either get access to the drug or become terminal when you're not terminal? Like, hey, I've been depressed for years. I don't want to do this anymore. I've been on and off sick. What do I have to do to get these medications? Well, you have to be terminal. Can you mark me as terminal? No, I can't. Well, what if I have a lot of money? Can I now be marked terminal? Because we see a lot of pay to play in the pharmaceutical industry. So could this lead to the point where doctors potentially get kickbacks for assisted death because it's now the new money drug,
That is a very, very good point. And I like saying that, that's a good point because you got me thinking here. And if you hear me say that, guys, on the podcast, I'm usually trying to think of some sort of rebuttal to this. Long and short, I don't know, Mike. I really don't. There needs to be fail safes put in place, but is any process 100% safe and 100% efficient? No, absolutely not. Now, if they have a history of chronic depression and there's, they don't have these diseases that they so-called terminal, then the doctor by law shouldn't be able to do this. And here's the thing too, is I've read, there's certain suicide pacts, not like pacts like writing the letter saying, hey, whenever the Hale Bopp comet comes, we're going to drink Kool-Aid and go to Stargate 9. More so like there was a company that was sending helium, right? Sending a canister of helium to some folks. And this is like a kill yourself kit. Okay. You basically put a trash bag over your head. You turn the helium on. You breathe the helium. It displaces all the oxygen and you die. I mean, it's simple as that. It's almost, to me, I almost liken it to marijuana. Okay. Not that marijuana is going to kill you, but marijuana is not so reclusive, I guess, for lack of better words, that people can't find ways to grow their own marijuana, to process their own marijuana. So I don't think it would be something that the pharmaceutical industry would necessarily latch onto, especially in America. I mean, I've read recent stats that at least 70 to 80% of Americans identify as Christians. And if you read into the Bible and things like that, there's one of Moses's commandments is thou shalt not kill. I mean, that came down from God into the flaming bush and the tablets and all this. Yeah. I mean, it really comes into a point where I don't see this ever being something that is mainstream or even for profit, to be quite honest with you. However, sorry, go ahead, buddy.
Well, it's tough to hear you say that because there's been a lot of times where things have kind of creeped up like this. And I don't mean people trying to, legally or assisted, commit suicide, but I'm trying to think of one that's not so politically out there. But, I'll just say, what about, let's look at the transgender movement. I think a lot of people thought that would never spin into something huge, right? They're like, oh, okay, this will go away. I don't see it getting that big. It's not that big a deal. But here we are, in Canada, and now there's this compelled speech law. And it's enforced that you have to call trans people by their preferred pronoun or you can be arrested. So I don't necessarily believe you when you say, I don't think this could ever get that way or go that far. I think anything can go that far. And if it has the opportunity, anything will go that far.
Well, obviously, I mean, that's like Nazi Germany and back in 1933, right? I watched a conspiracy thing and I'll just go off this caveat just real quick, right? And it kind of goes to our 9/11 conspiracy we were talking about today, is that the German parliament was burnt down in 1933, right? And basically at the time, the Nazi party was the largest political party in Germany besides the Communist Party, okay? So what they did is they scapegoated this Dutch man with learning disabilities that may or may not have been a part of the Communist Party. They put these flyers on him, all this stuff. Like this Parliament building burned down in 9 minutes. Not just one guy that can do it. So to kind of liken it to your point, is it something that is possible? Yes. Is it something that's highly likely? I can't answer that. I don't know. But for me and how I view it anyways, is that this is a very, very touchy subject. I mean, when you start to talk about your own life and morality and all this, and it differs from how you identify yourself as a transgender movement, right?
Right.
I think it has a higher specific gravity to it. It's not like, well, okay, well, I just want to die, and we just give you a pill and you die. I don't see it coming to that. It may go to that 200-300 years from now. It might get to the point that Earth is so heavily populated that they're just like, hey, if you want to die, see ya, and you're gone.
Right. So let me for the people listening, let me read out what qualifies you under the death with dignity status, and then I'm going to let everybody know what the medications are that are most typically used and what they do. Okay, so to qualify under the death with dignity status, you have to be an adult resident of a state. Well, first off, what qualifies an adult? Okay, if you're looking at the court system, they've tried teenagers as adults before, so that's probably a gray area there. So an adult resident of a state where such a law is in effect. So California, Colorado, Oregon, the states we mentioned before. You have to be mentally competent. So I'd like to see how they determine that. And it says capable of making and communicating your healthcare decisions. diagnosed with a terminal illness that will lead to death within 6 months, as confirmed by 2 physicians. And the last one is capable of self-administering and ingesting medications without assistance. So I think that one there is probably the most important. And I do like that they enforce that you have to take the medication yourself. You have to swallow it yourself. You have to go pick it up yourself. They try to take all the middlemen out of it. I like that, but still it has to be prescribed by a doctor, and still what's it called? Somebody has a pharmacist has to give it to you. And then the way they're doing this, let's see, the most common one used is it's a 2-stage process in a pill form. So it's secobarbital, if I'm pronouncing that correctly, and the second one is and it's followed by, so you take that one first, and then the second one that you would take is pentobarbital.
The barbital it's in the barbiturate family, and it's more so for relaxant. If you think about what they use in prisons for lethal injections, they use sodium pentanol. They use one of the barbitals, I think one of those that you said as well. And then there's a third drug that's administered. So I could see the one being kind of like, all right, that's almost a fail-safe in a way, taking the first one, because the first one itself isn't going to kill you.
Right.
Now,
so
now the
in
Pinto,
prison, sorry, go ahead.
Oh no, in prison, I've seen those shows. I know what happens in prison.
But in prison, they use 3 different drugs. It's sodium thiopental. That's used to induce unconsciousness. So in prison, they do a 3-step process. The first one is they put you in an unconscious state. Then they give you the second drug. The second drug is I'm gonna butcher this, but it's a bromide. So it's pancuronium bromide. Short is Pavilon, and that causes muscle paralysis and respiratory arrest. So at that point, you are unconscious, you're paralyzed, and your lungs have stopped. Okay, so the last portion is the heart, which they administer potassium chloride, and that stops the heart. So in prison, you do get, you slowly kind of go to sleep, and then they stop your heart. So that is kind of a nicer way to go, but it looks like the way they're doing these assisted deaths is through a 2-stage process. And it doesn't necessarily say what these 2 drugs do, but I'm assuming the first one is like a sedative, and the second one is more harmful, where it actually does perform the process of killing you. Is that accurate?
Yeah, that sounds 100% accurate from what I've seen anyways. So I kind of liked how you talked about taking the middleman out of all this. It puts it on the person. But the literature behind this, the semantics of it are very, very vague. Like you were talking about with the adult, let's just say the adult one for the example. What constitutes an adult? Is there an intelligence test? You got to score 70 out of 100 to be considered an adult. Is it by an age? I mean, you could be 18 years old and have mental disabilities and have the cognitive functioning of a 5-year-old. You could be 50-year-old. You can be 50 years old and have the cognitive functioning of a 5-year-old. So it really comes down to, I don't know. I really don't know. I mean, that's what's crazy about it, is that you can go to the doctor and they can determine that you're suitable to die or not to die. But in the real libertarian approach of it, you're responsible for yourself without doing harm to others. So how do you approach that? And it leads a lot of legal avenues. And here's my thing too. What about the malpractice on it? I'm a doctor in beautiful Newburgh, Indiana. Okay. You come in, you're a resident of Indiana. You meet all these qualifications of the Death with Dignity Act. And you're like, Doc, I want to die. Cool. All right. So we go through our processes. I do everything that is I'm legally bound to do. Okay. I write the prescription. You have the prescription filled. You go to your house, you take the drugs. And here's a couple different situations, right? You take the drugs and they have no effect on you. They don't kill you. Second situation, you take one drug, it has a very adverse effect to you, and you don't take the second drug. You don't kill yourself. Third situation is you take both the drugs and you die. and you're surrounded by family or whomever, and they say, man, this was not a dignified way to die. This doesn't match up with this. And then I'm slapped with a malpractice lawsuit. I lose my license. I go to federal prison. I mean, who's going to sign off on that? I'm not. If it's between that and me having a job and me not going to jail and making big rocks into small rocks and moving those piles, I'm not going to write that. And if I'm the pharmacist, I sure as hell am not going to fill that script.
Yeah, and I actually know people that has happened to, not so much as killing themselves, but they use similar medications for abortions. So if you're within a certain time frame of your pregnancy, you can take a 2-stage pill. The first pill kills the baby. The second pill forces like an ejection. So you basically give birth to a dead baby.
You have a miscarriage, more or less.
Yeah, it induces a miscarriage. So I actually know a girl that this happened to. She took the first pill, it killed the baby, and it never came out. The second pill didn't cause anything. So she had to go back to the doctor like a couple weeks later, because I think they make you wait like 2 weeks before, in between these two pills. And she had to get them again, and then finally it happened. But I mean, you're right. That could definitely happen with these drugs that, help you with this assisting in dying. What would happen? Have you seen the movie Law Abiding Citizen?
I have not.
Okay. So in this movie, Law Abiding Citizen, these two guys, they perform like a terrible crime. One of them gets sentenced to death. It's lethal injection. And the guy that they did this to is still alive. And this guy had killed his wife and daughter. So he's a real brain thinker, and he changes out the medications that they use during the lethal injection for something more heinous. And it ends up being like this freak show deal where they inject him with this stuff and he freaks out and he's screaming and basically like bleeds from his eyes and stuff. Is something like that possible with these, where maybe you get the first drug right and then the second one they give you something that's not exactly right or the wrong dosage, and now you're not dead, but you're kind of twisted and messed up, you know what I mean? Like maybe it just causes a stroke or a seizure, and now they can't give you a second dose of it because you're not necessarily terminal, or you're still terminal, but you can't make a decision to get the drugs again. Like what happens? What do you do?
Well, you have a guy there with a black mask on that has a 45 caliber pistol pointed at your head, right? With 10 rounds in it, and he shoots you. No, that's a great question. And that's the thing too about these pharmaceuticals, kind of like we talked about before, is that, specific medical interactions with specific individuals is not going to have the desired effect. It's like people that are allergic to, let's just say penicillin or something like that, right?
Right.
Penicillin's great at killing whatever penicillin has to kill, but you give it to somebody that's allergic to it and you could possibly kill them. You're going to have very adverse effects to that. So it really there's a lot of stuff that needs to be ironed out in this. And now, is there a wonder drug that's going to kill you 100% of the time? No, absolutely not. So maybe they see other methods of euthanasia. Maybe you bring back the guillotine. You come to Uncle Mike's Guillotine Emporium, and you go up there, you sign your waivers, you're signed off, you get your last rites, all this stuff. Big burly guy in a hood pulls the lever, your head's chopped off, you're dead. That's a humane way to die. You're disconnected from your body. I mean, there's just so many caveats behind it. I just don't trust modern medicine, and I can't believe I'm telling you that right now, with all the arguments we've had about pharmaceuticals and medical situations, that I just don't trust it 100%.
Welcome to the dark side.
I know. Gosh, I can't believe I admitted that. I feel gross now. Like I need to take a shower.
Well, let's look further in the future though. Kind of spinning off what you were just talking about going to Mike's fucking guillotine, whatever. What if this progresses? It becomes legal in all states. It becomes more socially acceptable, and now it's moving away from physicians, and now you can go to these. I don't want to say voodoo, but what if you go
contractors? You go to a contractor, a death contractor.
Yeah, like a spiritual event, and you want to go and sit in this dark room with black lights and lay back, and you're ready to end your. And this is more of a suicide scenario, right? But I mean, I could see people pushing it this far. You know, I could see the argument of how come they're allowed to die, and it's because they're sick, and I want to die, and I'm not sick. Why do they get to choose their death, and I can't choose mine? And it becomes a equality thing, and I could just see people complaining about that, and it just takes one court case to get ruled in favor of that person wanting to die whenever they want, and it's just over. It's over with right there. You know what I mean? That just opens the floodgates.
Yeah, I mean that's a really, really libertarian view on it. I mean, it really is. But you're right. I mean, who knows how this takes off and what kind of stops could be put into place to stop something from this becoming a fad. I hate to say taking your own life would be a fad or a faddish thing or something like that, but we've seen before where somebody dies of a weird circumstance and then there's 10 other people that copycat it.
Oh, dude. I mean, dude, we see harmful fads all the time. There was a look at those challenges, the Tide Pod challenge. There was a challenge where you had to light yourself on fire.
Yeah,
I mean,
blue whale. Do you remember the blue whale one?
Which one was that?
The blue whale one was where they would get certain clues that they had to accomplish for as a set amount of time. You had so many challenges you could do, and once you completed the challenge, you went to the next one. But at the very end of it, like the challenge was like kill yourself. And there's like thousands of kids just like killing themselves. And of course, this originated from Russia, obviously. Duh.
I actually think I did hear about that. And I don't remember for sure who I heard it from, but I actually think I heard that from one of my kids.
I know. Isn't that crazy? Like the kids know this and like they think they're just playing a harmless game. And here we go into the what makes an adult. They're children. They might have an adult's mind, but they're still children. So right. It really spins off to a lot of different things. But I believe that in whole, in a perfect system, in a vacuum, I hate to use that term, but in a vacuum, that a person does have a right to determine that their life is, it's sufferable. And they don't want to suffer anymore, and they want to take charge of that and control the only thing that they can take charge of in their life, having a terminal decision to make. But what really affects me is that some of these studies show that a quarter of these people are mentally ill.
Right.
And gosh, I mean, just think about this. The one time we have 1,000 cases, and one case out of 1,000, you have somebody that kills himself that isn't in the protocol of this or doesn't want to die. What happens? You take the first drug and it's an irreversible drug.
Right.
And you're going to die and you're sitting there and you're in pain for the last whatever. You know what I'm saying?
Yeah.
That's what I don't get. That's what I don't get at all. I mean, why you just leave a lot of stuff open and a lot to be desired with it. I mean, what would be some safeguards? I kind of went over my thing on euthanasia, how I would approach it if I was in that situation. If I was the lawmaker, what if Mike from the Knuckle Dragon Billy Goat Review with Mike and Josh was the lawmaker? How would you approach this, Mike?
Well, the first thing we'd have to do, I think, is get stricter definitions, right? So they say adult. Okay, what's adult? They say terminal. Is there a gray area with terminal? How are we deciding who lives and dies? And that is the problem right there. I think that is the largest problem is how are we deciding and why are we deciding? Okay. Is it up to the individual? It's not up to the individual. Okay. It's up to the doctors who is living and dying. And I think that is a huge problem. Okay. So I looked up the definition of adult and it's vague. Of course, it doesn't give an age because you can't determine if someone is an adult by their age. Okay. So it's a person who is fully grown or developed. That's what it says. Okay. So I would assume that in a court system, they determine whether you're an adult, how to be tried as an adult or as a minor, differently than the Webster dictionary version. But so I think it comes down to, for me, doctors are now deciding when someone can live and when someone can die. And I think when you have that God aspect there, and I view this the same way in the prison system, is why are we deciding who lives and who dies? and this is a new thought for me. I used to be, when I was younger, I was like, yeah, if they kill somebody, kill them, eye for an eye. But I think the more times you do eye for an eye, the more you become inhumane and unethical, and it's not morally right. I don't think anybody should determine who lives and who dies. So if we're leaving this up to physicians to determine who is eligible to die, I think that's pretty rough. And I'm gonna go pretty bold here. If it was in Michael's world here, I would say they should suffer and die. And if they want to commit suicide, then they should do it on their own behalf, in any other form or fashion that they want, and they shouldn't involve anybody else. That's I think that's a bold statement, and I think I'm going to stick behind that. I think nobody else should be involved. I don't think doctors should be prescribing medications to people that are going to kill them. I do agree with doctors prescribing medications to help them as far as like pain. So like I know morphine, right? Usually cancer patients, the people who are on their way out, people who are terminal and they're really, really in pain, morphine. You can make people comfortable, and they already do that. You can make people as comfortable as you want, but I think the moment you start saying, yes, you can die, no, you're not ready to die yet, that's a problem. I don't think you should leave that up to any individual from any background. I don't care how much schooling you have. I don't think somebody should determine who lives and who dies.
Yeah, that's a very good point. And you're talking about the morphine there. You're talking about palliative care, right? Basically
Right.
hospices. You're
Yeah.
going to die, and you go to the hospice, and they give you a big spliff and a shot of the morphine, and you watch Golden Girls at 4, and you eat dinner at 4:30 and go to bed at 5, and you wake up at 5 in the morning, and you do this again until you die. I really do like. I don't agree with everything you have to say on that, obviously. But here's what I do agree with is that a person should have the right, if they want to, take their own life, to take their own life. However, there doesn't need to be anyone else involved in that situation. They need to be the ones to do that. And they're going to say, well, what about the people that are vegetables or paralyzed that want to die and can't do it, blah, 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 blah. Okay, you're getting to, Exhibit 1A on this, or Exhibit 1B.
Well,
And
I actually have a thought already on the whole vegetable deal, if you'd like to hear it.
be my guest.
So I should have mentioned that in my remarks earlier, but so with vegetable people, so what I determine, or what I'm classifying as a vegetable is probably not the correct word, but it's probably rude. People who are in an unconscious state that don't have any brain function. So I think that's what determines if they're in a vegetative state, is that they're basically bedridden. They don't have any brain function anymore, and they're on life support. So, or maybe they're breathing on their own with no brain function. I don't know. But the moment they can recognize there's no brain function, and you've been in that state for I don't know what the specific amount of time is, I think it should be left up to the family. I think the family would know best in that situation. I don't think anybody else should make that decision. And at that point, I mean, you just have to pull them off life support, and they would just pass on their own. It's the doctors choosing to keep them alive, or the families choosing to pay the bills to keep them alive. And if it's up to them, and there's no way out of that vegetative state, I mean, you're holding on to something that's not really there. So I would say in that scenario, pull the plug.
Yeah, that's a pretty interesting viewpoint on that, Mike. But it almost goes back to what we were talking about earlier. We were talking about people that want to commit euthanasia, and there's a medication that's on the path to be there. What right do we have to pull the plug on somebody whenever they might have some sort of drug that's going to be there to help them out down the ways? But do you remember a lady by the name of Terry Schiavo? She was in the news a lot. It was one of these Terry Schiavo. I'm going to drop a little Terry Schiavo action on you. But she was basically in a right to die case. And dude, this was for 15 years. She was basically in a persistent vegetative state, right? Okay. And her husband and guardian, I don't understand that. I thought if you're a husband, you're also guardian as well. But they said that she would not want to be on life support without the prospect of recovery, right? And they elected to have the feeding tube taken away, right?
Right.
And it went basically downhill as that government got involved. Yeah, I mean, it went up to Bush, George W. Bush at the time in '05, to have her feeding tube delayed to be taken out.
I think I remember this. I do remember this now.
Dude, the delay on it, 7 years.
Whoa.
7 years. And basically what happened is that it looks like she was left comatose in a way. She basically lost oxygen to her brain, yada, 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 yada. And let's see here. I'm looking at the dates here. So just hold on 1 second. Okay. So it looks like in 98. So let's say 8 years after she's in this state. So she's in this state for 8 years.
Mm.
Eight. First of all, the first thing I'm thinking about is like, holy shit, that is a lot of money to be used to basically keep somebody alive that isn't going to have a certain quality of life, kind of like we talked about earlier, having that certain quality of life. So her husband and guardian, they make the decision to have this feeding tube removed, and the hospital's like, oh, no, 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 no. And it goes up through circuit courts, district courts. It makes it all the way to through the federal court system. And I guess Bush finally signs off on it, but basically he put like a stay on it. She had almost like a stay of execution in a ways. But what's funny here, we were talking about the Bushes intertangled relationships and whatnot. You want to guess who the governor of Florida was at the time?
Oh, Bush's son. I don't know.
It was his Jeb Bush, I think, as like his brother or somebody like that.
Oh.
But they check this out. They had 4 denials out of the Supreme Court. I mean, what? That is crazy. And they said this is like for the pro-life movement. What kind of quality of life are you going to have? And this comes down, I guess he didn't have a medical directive of how she wanted to die. But I mean, that's our country as a whole. I mean, can you imagine, like, this is like a 15-year diagnosis. I mean, she is 5, I think it said 4 months into it. They're like, she's going to be in a persistent vegetative state, which tells me is that she's a vegetable. I mean, I don't know if that's the correct term. I hear vegetative, and I hate to be very non-politically correct, but
it is. I actually looked it up. So let's see. This is the definition of a vegetative state in the medical field. Okay, so a vegetative state is absence of responsiveness and awareness due to overwhelming dysfunction of the cerebral hemispheres with sufficient sparing of the, I'm going to mess this up, diencephalon and brain stem to preserve autonomic and motor reflexes and sleep-wake cycles.
Oh, yeah. I mean, that's basically like...
You're brain dead.
Yeah. And more so how we talked about earlier is that, you basically have 2 levels of your brain, right? You have your lower level brain. It takes care of your heartbeat, your breathing, your certain primal urges. And then you have your higher level thinking. I mean, Terry Schiavo's higher level brain's taken out essentially right at her accident in 1990. Okay. And her lower level brain, I mean, she can't feed herself. She has a feeding tube. She's on a feeding tube for 15 years. How is that not cruel and unusual punishment? And that's something that they could have looked at as well into it. But I mean, this goes all the way to the president. The president, one case. And to me, this is kind of like an open and shut case. I'd be like, you know what? She's a vegetable. We can't afford this. I don't give a shit if it's right to life, whatever, She this is her wishes. This is what my wife would have wanted. Well, it's not in paper. That's not legal. Oh, fuck off. That's what gets me. A lot of it turns into these legal queries in a way, but they open the Pandora box on a lot of this.
Yeah, that whole scenario and that whole situation is like, it's like stewing in me right now. I see so many little issues with it.
Oh yeah, me too.
Like first off, okay, she's already been identified as, vegetable. what are you going to do? What's the first thing you're going to do there? You can't do anything. There's no recovering from that. We know that. That's a thing. We know that. You don't come back from being brain dead. Okay. Secondly, there's a financial situation there. First, what happens if her husband stops paying the bill? Who's paying the bill? Why is he paying the bill? Is she supposed to pay the bill? Who does that bill fall on? And if there is no bill and the government is paying for that, that's a bigger issue. And I don't know how or why the government would get involved with someone who is in a vegetative state on whether or not they can pull the plug or not. How does the government get to decide who lives, who dies, who stays on life support, who doesn't stay on life support? And I think that case is probably going to cause a lot of issues down the road when somebody wants to reference it and go, well, you made them stay alive. You know what I mean? That's a slippery slope. And I do not like when the government gets involved in things like that they should not be getting involved in. First off, yeah, sorry. First off, the government doesn't know best. That must be like the largest misconception on the planet. Just because you have a government body does not mean that they know best for the individual. That's not the case, especially medical stuff. That blows my mind that it went all the way up to the president. I didn't know that. I do recall that case, though, because I think I remember seeing the guy on TV and kind of like, I think they even showed her on TV. But that's a pretty messed up situation, man.
Yeah, and I mean there's a lot of different variables into it. That your wife's wish, her wish that that's your intimate partner of however many years, her wish is to die if she's ever in that state. And basically, if there would have been a health directive, like something written in paper, and I didn't see anything in the quick research I was doing about it that she had an advanced health directive on it.
Right.
But I mean, holy cow, wow. All right. Hey, here we go. There's an article from the Orlando Sentinel, right?
Right.
Let's see here. They got some numbers here. Hopefully they better not give me some bullshit like, oh, you got to subscribe to be on this. Fucking throw it. Okay. Wow. Let me see. Whoa. He sued the hospice. Michael Shivo, Terry's husband, sued the hospice for $700,000, right?
Yeah.
For medical malpractice.
Right.
It dwindled down to about 50 grand, and everything else went to his wife's fees, right? It says the average yearly cost of her care, this is at the hospice.
Right.
They said the average cost was $80,000 a year. This is at hospice. That's not even the hospital. So let's just say this, right? It is 15 years at hospice. 10 years, $800,000. Then add $80,000 to that for the next 5 years. So that's $840,000 just in hospice care. In hospice care, who knows? And who knows what else was? Who knows what else? I mean, I think once it gets to the national level, like they probably had some sort of support.
Right.
Like private donors or people that are using it for their political agenda and all this. But yeah, and with these private donors, and something I read about here is that there was a political action committee that was started towards the Terry Schiavo case itself. And her husband, Michael, was like, nah, dog, that ain't cool. Using his wife's condition and situation for a political sounding board. So, I mean, even coming back with euthanasia, I mean, it's such a diverse and such a very, very, very abrasive topic in the American psyche altogether. Now, there's other countries in the world that euthanasia is legal and widely available, I guess, in a certain aspect.
Yeah.
And maybe we can look at that. But here's the thing, too, is that in America is it's an interesting place. For lack of better words. I mean, it isn't a Sweden. It isn't a Denmark. It isn't the Netherlands. It isn't Britain. It's America. And there's so many different subsets and cultures and political views and religious views and all this. I mean, it really takes the cake on it.
All right. I have a scenario for you. Okay.
Shoot.
All right. So in talking about the euthanasia for humans, okay, I'm going to give you a scenario. Let's say someone is sick. They're almost terminal, but they have to take a medication. They take this medication, and if they don't, it will put them in a terminal state. Okay. So are doctors obligated to keep them on that medication, or are they allowed to elect to stop taking the medication, which puts them on a terminal status, which then allows them to get this assisted death medication?
Ooh, that's a tough one. You could be prescribed, I think, as long as the doctors do the due diligence on it and they say, here, this is the medication that you need to have so you don't go into a terminal category on this. It goes back to the passive euthanasia in a ways that would make them terminal in the ways that would qualify them for the Death with Dignity Act. So
Right.
that's a really, really slippery slope. Are we going to sit here and say, okay, well, we prescribed you Tylenol, you will take Tylenol so you do not die? Are we going to court order people to take medicine? I mean, I don't see that ever happening.
Again, I mean, weirder things have happened, but let's say there's a financial strain. Okay, so the medication that they have to take to stay alive, let's say it costs, I don't know, $80,000 a year. Who cares? Let's say it costs some crazy amount of money, and it's putting a huge strain on the family, and they're losing everything. You know, they had to refinance stuff. The IRS is after them. So they talk about it and they say, okay, look, I'm just going to stop taking the medication. I'll get put on terminal status and I'll go out peacefully with medication provided by, my physician and the pharmacist.
We essentially do that now without the last portion of having an assisted death in a ways. People do get in situations where they can't afford the medication. I mean, even if we go to our opioid epidemic that we have here, these oxycodons and oxycodone and oxycontin and oxy this and oxy that, or whatever kind of opiate-based medications that we have are expensive. They're not cheap medications to have, right? And that's with insurance. Now, people without insurance that need this, that have it, yes, they can afford it for a while, or they go to a dealer and get them for a while, but the price, it's so cost restrictive. Yeah, I guess that's a business term, cost restricted, cost prohibitive in a way. So what do they go to next, Mike? They go to heroin. Because A, it's cheaper. B, it does essentially the same thing. And
Right.
then 6 months to a year later, if they don't have an overdose or if they're not addicted to heroin, which that's a very, very small number, they're killing themselves anyway. So there's really just a roundabout way of people participating in euthanasia. And I think what you're kind of stemming it on is physician assisted or doctor assisted euthanasia, which would more so be active in the realm that we're thinking of, like, hey, here's the pills to take to kill yourself, or here's the pills that you need not to die. But it ultimately comes down to the person and their, I don't want to say moral compass, because I'm not one to say that you should kill yourself or shouldn't kill yourself or whatever. That's between you and whatever belief system you have or don't have. I mean, that's on you. Ultra hippie patchouli statement of the year there. But I think it just comes down to the individual, and people are going to get what they want one way or the other. And I kind of liked what you were mentioning earlier about the government getting involved with a lot of these things. That would be the absolute worst thing that could happen. Hands down.
Yeah. Let me give you another scenario here. I'm just kind of playing devil's advocate at this point. I want to see, because I think there is a line, right? And I think I kind of pointed out my line, in that I don't think anybody else should be involved in your own death, and I don't think they should be legally obligated to assist in that. So that's kind of my line. So I'm trying to figure out really where your line is by giving you these scenarios. So here's another one, right? They say euthanasia is going to be voluntary. Okay, so nobody can tell you to do it. Nobody can say, I think you should do this. You're terminal. Here's an option for you. Okay, so nobody can help you make that decision. Okay. So, let's say you have an elderly person in a nursing home. Okay. And they can barely understand the breakfast menu. Okay. What if they're asked to sign a form consenting to be killed? Is this voluntary or involuntary? And there's more to this. Hold on.
Oh yeah, definitely. I mean, to answer the first part of it, are they cognizant at that time? I mean, it really specifically gets down to, are they aware of what they are signing at their time? Are they cognizant of it? You can be, there's people that have Alzheimer's and diseases like that have moments of clarity. Maybe that's a moment that they have clarity. And how do we define what the moment of clarity is, and if that is actually a legal, permissible situation?
Right. So, what if she knows, or he knows, this person in the elderly home, in the nursing home? What if they know they are being a financial burden? Can they then, I guess, push to be on this terminal list? Maybe they understand that their life is no longer going to be anything, and they're bound to a nursing home bed. They may not have a terminal disease that's going to kill them in 6 months, but I'm looking down the road here, because I know that the 6 months is going to be pushed. That's going to be a thing. They're going to say, you're terminal, you're going to be 7 months. Oh, it's going to be 10 months. And somebody's going to go, well, come on, don't make me wait longer. Like, I'm in pain. So I could see them pushing this a little bit further than 6 months, right?
What if you're 6 months one day?
Well, that's a thing. And I mean,
Yeah.
and these are obviously educated guesses, right?
Oh, definitely.
When they say 6 months, there's nothing that goes, okay, at 6 months, you're definitely going to die.
At 6 months, you're going to die, or 6 months is going to turn into you're going to live the rest of your life. You don't know.
Right. And how many people have been misdiagnosed? Okay. I know we're getting better with things, but how many people have been told you don't have long to live? It could be a week, month, year, and they completely come out of it just fine. The doctor was completely wrong. That happens.
Oh, definitely. And I mean, that's what comes down to, I guess you're more so playing the law of averages. And you bring up very, very good points. And I guess I could give you my stance on this, of what I would think would be permissible and what would be inadmissible or non-permissible in a ways. First of all, the person has to be able to be cognizant of what they're signing. Now, how do we see that they're cognizant of that? Maybe we give them some sort of psychological test. Maybe they meet with a psychiatrist. Maybe they talk with their physician and their family and an attorney, and get that, at this time I'm not being forced to participate in euthanasia. I'm not being forced to do this, that, or the other, and kind of go through the whole gamut of things. If they are not able to say, yes, I want to die, I know that I want to die, kind of like the lady in the nursing home that can't read the breakfast menu. Right. I think that's where you have to draw the line. You have to say, you know what, there's no way, unless she has an advanced health directive that says, if I become a certain state, yada, 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 for X amount of time, I want to be euthanized, I want to be put down, then it kind of goes back to your thing, is that, yeah, she might be suffering, that she might be a burden on her family. But I guess I'm using air quotes here. I know you can't see them, but air quotes, the right thing to do is to keep her in that palliative care. Are you going to, and you've talked about it too, and you almost remember with the Affordable Care Act, Obamacare, that people were talking about death panels. Who lives and who dies. And that's a real thing that could definitely happen if it's not happening today. It's just, there's just a lot of different caveats to this, and I can't give 100% definitive answer on how I feel about it. But I guess the main things for me is that you need to be of a legal age as defined per the law. You need to be cognizant within a certain realm as defined by the law. And third of all, you need to go through all the ramifications of this law verbatim, line by line, per the law. So basically, follow the law and stay out of trouble.
Right.
And I know that, dude, I know that's ducking out of the questions that you have on that. I honestly know that. But I mean, for me, in my views of it, I mean, that's the top three for me, really. The person has to be able to be cognizant, has to be psychologically, I hate to use the term normal, but we'll use it for this case. Normal, not the 25% that are depressed, because depression would definitely have something to do in that. And wanting to die and then wanting to die because you are going to die are two different things, I think.
Okay. I got one more question for you. Okay. So this happened, and I want to get your thoughts on it. And I'm hoping you remember the case. Okay. There was a teenager, young man, who committed suicide. Okay. But they found a plethora of text messages from his girlfriend who was egging him on, telling him that he needed to do it. He's always wanted to do it. And so on. Okay. So there were some messages from him saying like he was having second thoughts. He wasn't sure about it. And she basically egged him on and he killed himself. Well, that went to trial and she was found guilty and she's in jail. Is that right or wrong?
That is a very, very obtuse question. Very obtuse question. Right or wrong by what does normal moral standards? Right or wrong by
Okay. Well, I'll put more on it then. Okay.
Okay, yeah, put a little bit more mustard and relish on it.
Yeah, I'll give you some more relish.
I bet you will.
So he ultimately killed himself. He wasn't there. He is fully capable to make his own decisions. Okay, when somebody kills himself, that is without anybody else's physical help. I don't think somebody has enough words to kill you. Now, I know there's a gray area there, and I know that's a touchy subject because people do get depressed based off of what other people say, and then they commit suicide, and then the people that were saying the rude and mean things, kind of cause that situation. But I don't think someone's words can actually make you commit suicide. So how is it that she did say some really harmful things and they were pretty messed up. I mean, they posted some of them on the internet, but did she help kill that guy?
Oh, most definitely. And to answer the question as a whole, yes, it's wrong. It is absolutely wrong. And people are saying, well, she has a First Amendment right, freedom of speech, and blah, 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 blah. No. And more so here, a speaker is not protected by the First Amendment if their speech is intended to incite or produce imminent unlawful action, and if such unlawful action is substantially likely to occur. So, okay, I know, I'm a depressive anyways, right? And that'd be like you texting me day after day, hey, kill yourself. Hey, you're worthless. Kill yourself. Hey, you're worthless. Kill yourself. You're putting fuel on the fire. So there's a lot more to this situation when we knock down to it. But I believe they're from Massachusetts, right? From what I'm reading in this article. And it says here that Massachusetts common law has never said that words alone without a physical presence has been sufficient to constitute a homicide until this case. So what about the kids that are bullying and the other kids at school, They bully kids off the clock. They're not at school. They're sending them, Facebook messages, text. Hey, you're this, you're that, you're a piece of shit, yada, 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 yada. Do we start prosecuting those kids? In my opinion, yes. Yes, we do. Absolutely. If you can't treat a person with the proper respect and you're telling somebody to kill them, I can understand saying like, hey, you're ugly, you're a piece of shit, yada, yada, yada. But once you start using certain terms, Michael, you're just adding fuel to the fire. And I think that the kid should be liable for it, and the parent should be liable for it. Boom. Ooh. Chew on that.
Man, I don't know, buddy.
I'm sorry. I'm just setting the trap here. That's definitely a discussion we can have another time. But in that case, you know what? That is not euthanasia. That is getting somebody to kill themselves, that wants to kill themselves in a way, and bullying them into killing themselves, which is morally and ethically wrong. I rest my case.
I totally agree with you on that. So I guess on closing here, do you got any final thoughts on the euthanasia and the states that are pushing forward on assisted deaths? I think, what did we say, 7 states?
Yeah, around 7, yes. My view on euthanasia, if it was in a perfect system in a vacuum where the person was cognizant to make their decisions, was cleared by a psychiatrist and doctor, maybe even more so their family, to know what their wishes are tested out to be found with no mental defect that could degrade them wanting to take their life, and them having the capability of taking their life if they need to, euthanizing themselves. That it does. You brought up really, really great points that I've never thought about before, and I appreciate that so much. It really got me to think, what if this does become a mainstream thing? What if I can just go to the corner store and I buy Plan K for Jack Kevorkian, which was a very well-known euthanasia doctor in Michigan for years. I go to the corner store, I buy Plan K, and I just take care of it myself. It really, it's a very, very obtuse, I like using that word tonight, obtuse subject. I don't have a great definitive 100% answer for you of how I would approach it. And if I fully support it, I support it under some circumstances, and other circumstances I do not support it. So that's basically the talk on euthanasia that I have for tonight. And I appreciate you bringing up such great points. What are some final thoughts for you, Mike, if you wouldn't mind?
Well, I think I still stick by my statement that I don't think anyone else should be involved in your death. I think if you want to choose death, you should do it on your own terms. I think a lot of people currently commit suicide, and that's terrible. But if you're an older individual and you do feel like you're terminal and you're sick, I think there's other ways to do it that doesn't involve anybody else's moral or ethical standings, or anybody that's legally bound to it. So I think those are my final thoughts. And I think what we'll do here for the listeners out there, because I want to hear everybody's opinion on this, what we'll do is you guys can check us out on Facebook at the Knuckle Dragon Billy Goat Review. And we'll post the article on there. And if you can check on there, like the page, and comment on the article and kind of give us what your thoughts are. And maybe we'll do a part 2 to this once we get some feedback from the listeners here. Okay. And then you guys can check us out on SoundCloud, iTunes. And we'll see you next time on the Knuckle Dragon Billy Goat Review.